Good evening. Hi, this is Valerie Leonard. I am the founder of nonprofit Utopia. I want to say welcome. I am doing this live stream on the spur of the moment. I was working on my website, sharing with folks the information about the COVID-19 plan from Joseph Biden, our president, and it occurred to me maybe you guys would be interested in hearing more about the plan and how it might impact you. We're going to go over today or tonight the plan itself. We're not going to go over all 200 pages of it, but we will go over the executive summary. I'll share with you where you can get the plan and digest it for yourselves. Our focus is looking at the impact of the plan and how it's going to impact our communities, right? So primarily Black and Brown communities, but there's something in it for everyone. All right. So without further ado, I want to share my screen. And I want to take you to the tab. Just a moment. All right, so I'm going to reduce this so you can see what this looks like if you pull it down. This is the national strategy for the COVID-19 response and pandemic preparedness. And this was just signed into, this supports an executive order that was signed into law just a couple days ago. This is one of the first things that the president shared right after the inauguration. And I'm going to expand it. And you can find this on whitehouse.gov. All right. So this is the executive summary. There are 7 goals with this plan. The first one is to restore trust with the American people. The second is to mount a safe, effective, and comprehensive vaccination campaign. The third is to mitigate the spread through expanding masking, testing, data, treatments, healthcare, workforce, and clear public health standards. The fourth one is immediately expand emergency relief and exercise the Defense Production Act. And the fifth one is to safely reopen schools, businesses, and travel while protecting workers. The sixth one is to protect those most at risk and advance equity, including across racial, ethnic, and rural and urban lines. And then finally, to restore U.S. leadership globally and build better preparedness for future threats. So I'm going to focus on the ones that I think are going to immediately impact us as citizens, as community members, and those of us who run nonprofits or might work with nonprofits. All right, so the first goal is to restore trust with the American people. As you know, there's been a lot of misinformation in the past year or so about COVID-19, about vaccines, and there's a lot of questions as to whether or not what we're doing is safe. So their first order of business is to open the lines of communication, work with people, and make sure that they provide reliable information that's based on science. All right, they're going to establish a national COVID-19 response structure. So that is, they're going to have a task force. They already have a task force that will coordinate all of that work. All right, so Biden issued executive order organizing and mobilizing the U.S. government to provide a unified and effective response to combat COVID-19. and how to provide United States leadership on global health and security. So if you go to whitehouse.gov, you should be able to get that. All right, so part of restoring trust is he's going to conduct regular expert-led, science-based public briefings. He's going to also publicly share data around key response indicators. So they're going to have what we call data-driven responses. So they're going to be able to immediately know where they are in terms of the progression of this disease and where they are in terms of how we are, um, the community response and whether or not we get the vaccine and testing and all of that good stuff. So part of what he wants to do is engage the American people. And he realizes that this is not a government does it all by himself problem, right? So I see plenty of opportunities for folks at churches, community-based organizations, nonprofits to get involved in this fight. A number of you are already responding to COVID-19. There's going to be increased engagement of the American public along with healthcare providers and the government officials. So look for increased chances to collaborate with your government officials and healthcare folks. And then again, they're going to have health campaigns that are driven by science. So the second goal is to mount a safe, effective, and comprehensive vaccination campaign, and especially to make sure that there is outreach into the local communities. All right, so they want to make sure that there's availability of safe, effective vaccines for the American public. There's a serious shortage in those vaccines, right? So they want to accelerate getting shots into the arms and get vaccines into the community. So what that's going to mean, again, is making sure that they reach hard to reach populations. Hard to reach populations could be senior citizens, it could be immigrants, it could be people who live in people who are homeless, right? Or have some sort of transitional home situation. So they're going to make sure that they create as many venues as possible to get people vaccinated. As I said before, they're going to focus on hard to reach and high risk populations. So I'd imagine that the mobilization is going to be very, very similar to what they did for the census. You notice a year or so ago when we got mobilized for the census, the government, state and local governments worked with some of our local officials as well as our community. So I would imagine that if you're a nonprofit with experience with that census outreach and voter registration outreach, those would give you really good skills to work with, outreach as it relates to COVID-19. And a number of you are already doing it, right? And you also want to make sure that the providers and state and local governments are fairly compensated. Apparently, there were some issues with people and governments being reimbursed for their equity. For their outreach with COVID-19. And then they want to make sure that they drive equity throughout the vaccination campaign and have a broader pandemic response. So this means making sure that folks in communities, again, that are hardest hit can actually get greater access than they had been getting to those vaccines. So they're going to launch a national campaign for vaccinations and public education. So I would imagine too, if you are an organization that is involved with COVID-19 already and those who might be interested, there could be an opportunity for you to participate in campaigns. And I don't know this for sure, but it just seems to reason that there would also be opportunities for you to help educate the community as to what the truth is around the COVID-19 virus and vaccinations. All right, so they want to improve the data systems and transparency of vaccinations. And then they want to make sure that they monitor the vaccine safety and efficacy. And, this is really critical, especially since that we're in uncharted territory and we don't really know what, what's, what could happen with the vaccine. We're doing this as best as we can. And I have a tendency to say we, I am not doing anything personally, but the government is acting as swiftly as they can to get the vaccines on the street. So the third goal is to mitigate the spread by expanding masking, testing, and treatment and data and workforce and clear public health standards. So in this case, they want to make sure that they increase the supply of masks. There have been shortages. And those of you who are distributing masks, I can see this as a great opportunity to expand the reach, assuming that there will be more masks in production. And then also, if you're selling them, this is a good business opportunity for you. And again, they're going to make sure that the public health standards are clear. As you know, there's been a whole heck of a lot of misinformation as it relates to the virus. Okay. I want to focus on those areas that impact us directly. A lot of this is medical. And not that medical doesn't impact us directly, but most of us are not medical professionals, the ones that I'm speaking with, and I'm not one either. All right, so they want to immediately expand emergency relief and exercise the Defense Production Act. So basically, what that is saying is they want to make sure that all hands are on deck. So they're going to strongly encourage manufacturing companies, if they're not developing vaccines or things that are related to vaccines, such as the personal protection equipment, they're going to actually ask them to ramp up their production, and they will provide incentives. And in some cases, I believe the law might not just encourage, but they might be instructed to do it. All right, so they want to increase emergency funding to states. So they're going to provide more money for their FEMA response. And remember, too, that FEMA also can cover disaster preparedness, and some of that overlaps with the SBA funding for COVID-19. So look for opportunities for small businesses as well as property owners to get some relief. And then they want to fill supply shortfalls by invoking the Defense Production Act. All right, so what this means is they're looking to accelerate manufacturing, delivery, and administration to meet those shortfalls. So again, if you're in the business of developing those masks, swabs, any of that health equipment, they are going to actually lean on the manufacturers to increase their production. All right. They want to safely reopen schools, so they're going to be developing protocols for safety so that we can safely open our schools and travel and make sure that we don't get COVID-19. And again, I believe that there's going to be an opportunity for folks in nonprofit to help make sure that there's good community outreach, because again, the government agencies can't do it all by themselves. So they're going to really need to rely on block clubs, nonprofit agencies, etc., to get the word out. Okay, so they want to make sure that they can safely reopen not only the schools, but the child care centers. So if you run a daycare center, you really, really need to keep your nose to the ground. President Biden has called on Congress to provide a $25 billion emergency stabilization fund to support hard-hit child care providers through the pandemic. So that is very, very important. Okay, and for FEMA, I skipped over FEMA. There's going to be $130 billion in funds for schools, just to make sure that the schools open safely. And then there's going to be $350 billion in flexible state and local relief funds that will help districts avoid layoffs and close budget gaps and provide additional resources for safely reopening. Okay, they want to support equitable reopening and operation in higher education. So what they noticed is that college enrollment for high school graduates was down more than 20%, right, as a result of the COVID-19. So they're going to provide an additional $35 billion in emergency stabilization funds so that kids can go back to school, and also to make sure that this happens in a very safe manner, right? They want to protect workers and issue stronger worker safety guidance. So there's going to be increases. They're going to monitor OSHA. So they're going to modify that to make sure that people are safer, especially as it relates to working in factories. They're going to provide guidance and support to safely open businesses. And I don't know if you've been paying attention, but one of the problems that we had under the prior administration is the federal government believed that the local governments and state governments should figure out what works best for them. But what they're going to do is provide guidance for safely reopening, and that will trickle down to the state and local level. And then here they want to promote safe travel. All right, so goal 6, protect those most at risk and advance equity, including across racial, ethnic, and rural and urban lines. As you know, there's been a big divide as to who gets vaccinations and tests first. They want to make sure that they can increase the supply of vaccinations and tests in areas that are that are hit hardest, and typically those are in Black and Brown communities. All right, so they also want to create the COVID-19 Health Equity Task Force, and that will help them to coordinate all of the COVID-19 activities and make sure that there's language of equity from the top down. And they also want to convene national experts in health equity and provide recommendations. They want to increase data collection and reporting for high-risk groups, and high-risk groups are typically, older people, people in lower income communities, minority groups. Want to make sure that there's equity in access in terms of the COVID PPE. So that's protective personal equipment, tests, therapies, and whatnot. So they just want to make sure that the hardest hit communities have access to all of the equipment that they need. And here's something that you should really be cognizant of. They want to strengthen the social service safety net to address unmet basic needs. All right, so this is where the community groups have a chance to shine. This is where the nonprofits have a chance to shine. So with millions of families already struggling pre-pandemic to meet basic needs, including food, housing, and transportation, COVID-19 has exacerbated these challenges. These challenges contribute to difficulties by many to adhere to public health guidance. All right, so they're going to be looking to work with community-based organizations to make sure that they can, align with social interventions. And that to me suggests that there's going to be broad collaborations between organizations, their elected officials, healthcare experts to really focus on their specific communities to solve the problems, right? So they're going to support communities that are most at risk for COVID-19. And again, in many instances, these are Black and Brown communities. All you have to do is look at a map in the state of Illinois for IDPH, and you'll see where those hardest hit communities are. And then goal 7, and this is, they want to make sure that they restore America's place, as a leader globally to build better preparedness. We lost some stature over the past 4 years, given the way we didn't handle COVID-19. So they want to restore the United States relationship with World Health Organization. As you know, the United States withdrew from WHO. I believe, if not withdrew, we definitely stopped providing funds under the Trump administration. So they want to make sure that they can restore that relationship. And then they want to make sure, too, that they can increase their public health and humanitarian response around the world. So providing folks with assistance, not only in the United States, but around the world. Okay, and then they want to restore U.S. leadership to the international COVID-19 response and advance global health security and diplomacy. Okay, and again, this doesn't impact us directly, but just to let you know what's in it, they want to build better biopreparedness and expand resilience for biological threats around the world. All right, so that is basically the overview of the 7 strategies. That is the executive summary. This is a 200-page report, and you could go to whitehouse.gov and download it. It's the national strategy for the COVID-19 response and pandemic preparedness. And what you should do is go through it based on who you are. And when I say who you are, you could be reading it as an individual who wants to make sure he or she is safe. You want to look at it, I guess, in terms of a parent who has a child in public schools. You might look at it from a perspective of a business owner and look for not only the implications for the safety you need to provide in the workplace, but also there may be business opportunities for you as a result of this. All right, so I'm going to stop sharing, and if there are any questions, I will see if there are any questions or comments. Oh, thank you, Reverend Allen. I really appreciate that. Thank you so much. You've been a constant source of support. You don't know how important your remarks over time have been, so I thank you. All right, are there any other questions, any comments? Again, I see nothing but great opportunities, not only for us to be safer as citizens, but if you're working in a nonprofit, there are many opportunities available for you guys to put together comprehensive plans that will impact the community. And also, if you're a business owner, there are a number of business opportunities. If you just read between the lines, you see a need, you see problems, and you will fix them. All right, so I don't see any more questions or comments. I'm going to, this video will be available on YouTube. And again, I encourage you to go to whitehouse.gov and download the plan for yourself. All righty. Thanks again for watching. You take care. Bye-bye.